Hello, welcome to the StellaLife Innovator Series, everybody. Today, we're going to be learning from Dr. Dale Bredesen, MD, who's an internationally recognized neurologist with specialty expertise in the mechanisms of neurodegenerative diseases. He's the Senior Director of Precision Brain Health at Pacific Neuroscience Institute and the Chief Scientific Officer at Apollo Health. Guided by his philosophy and belief that Alzheimer's disease is not just preventable, but reversible, Dr. Bredesen's innovative research has helped explain the physical mechanism behind the erosion of memory seen in Alzheimer's disease. His decades of clinical study and neurological research have opened the door to new approaches to treatment, leading to the RECODE protocol. Also known as the Bredesen protocol, this methodology has emerged as a viable attempt to prevent, arrest, and reverse symptoms of cognitive decline associated with conditions such as Alzheimer's disease, dementia, and mild cognitive impairment. He's contributed significantly to medical knowledge and literature with over 30 patents in his name. Notably, he put much of his findings and research into the 2017 New York Times bestseller, The End of Alzheimer's. Welcome, Dr. Bredesen.
Thanks so much for having me, Liz.
So happy you're here. So I'd like to learn more about everything that you're doing. And so for those who may not be familiar with what you're doing, could you briefly explain what the RECODE protocol is and what success you've had with delivering it and how it differs from the traditional approaches to Alzheimer's and other dementias?
Yeah, great point. So we spent 30 years in the laboratory looking at basic mechanisms that drive the neurodegenerative process in Alzheimer's, in Lewy body, in frontotemporal dementia, ALS, so forth and so on. And what we discovered is that these simple models, oh, it's just about a misfolded protein, or it's just type 3 diabetes, or it's just herpes, these do not explain the problem. These are ultimately network insufficiencies. So you've got to look at the various contributors. And a typical person who develops Alzheimer's or is developing Alzheimer's will have about 10 different contributors. Things like chronic infections, various things that cause inflammation, leaky gut, things like that. Periodontitis, closely associated with Alzheimer's, actually. Various things that will create toxicity, mercury, biotoxins, things like that. And then anything that reduces energetics, so reduced blood flow, reduced oxygenation, sleep apnea being a common contributor. So that what we found is that when you are treating someone, number one, you want to get them in relatively early, of course. But number two, you want to identify all these different things, and then you want to address them. When we do that, first of all, we had the first reversals of cognitive decline, which were published back in 2014. We've now had two clinical trials that both show unprecedented improvements in people with cognitive decline associated with Alzheimer's disease. So this is a new era for all of us who are treating these neurodegenerative diseases, now that we understand that these aren't about a simple one thing happening. They are about the sum of a number of critical determinants that you can evaluate and you can address successfully.
Great. And so based on, what you've just said, can you share how oral health, sleep, and systemic inflammation fit into the picture of cognitive decline?
So, as we went through all the laboratory work and looked at all the things that are driving this, it's really turned out that Alzheimer's disease is largely an oral disease. If you look at the microbiome in the brain, and of course, just a few years ago, the thought was there is no brain microbiome, it should be a sterile organ. Well, that turns out to be wrong. There is a brain microbiome. And most of the organisms in the brain microbiome are oral organisms. And in fact, things like P. gingivalis and T. denticola and Prevotella intermedia and things like that are associated with cognitive decline. So the same pathogens that are a problem in the mouth are also a problem in the brain. And so, in fact, there is a tremendous amount that can be done by dentists, by oral health care experts. And in fact, in both of our clinical trials, we did cone beam. We sent people to dentists, every patient, for evaluation because of the numerous contributors. So I mentioned mercury, that's one of the critical ones. You mentioned airway, and airway very important, and people who have upper airway resistance or who have obstructive sleep apnea are definitely at higher risk for Alzheimer's. And we have people all the time. In fact, I talked to a patient and his wife yesterday, and this person has well-documented Alzheimer's disease, and she said, just realizing that he had sleep apnea and getting him on the CPAP, that alone made a clear difference. So airway, huge. Microbiome, as I mentioned earlier, huge. Gingivitis, periodontitis, P. gingivalis, looking at the oral DNA status, the microbiome status in the mouth, huge. And so all of these things are critical players. Even herpes simplex is another one that is found in the brains of Alzheimer's patients repeatedly. And in fact, there was a nice study out of Taiwan showing that just treating that was helpful and reduced dramatically the risk for developing Alzheimer's disease. So much of what is leading to Alzheimer's is actually coming from the oral cavity and from the areas where the doctors and the doctor teams cannot do this themselves. They're not out there, fixing periodontitis and gingivitis, and they're not out there doing, cone beams on their own and understanding what's driving this process. They're looking at things like leaky gut and changes in the immune system and chronic infections and things like this. So it is crucial for best outcomes for the dentists and for the doctors and their teams, their respective teams, to work together.
Absolutely. Yeah. And with your work, it's reached a wide audience through your books, The End of Alzheimer's, The End of Alzheimer's Program, The First Survivors of Alzheimer's, all of these books. And now, with your newest release, The Ageless Brain, that's coming out, can you share the journey behind these books and, what readers can expect from your latest book?
Yeah, thank you. So the first book came about because we had patients getting better for the first time in history. And in fact, patient zero, the very first one that I saw in April of 2012, is still doing well here 13 years later. And she is now walking across from the Pacific Ocean to the Atlantic Ocean. She's already about two-thirds of the way there. She's just ready to hit Louisiana. Just an amazing, amazing woman who's done very well. Now, I saw her when she was 67. She's just turned 81. So she's truly an amazing person. And so the idea of the original one, The End of Alzheimer's, was let's get this information into as many hands as possible so we can actually help to create a reduction in the global burden of dementia. That was the goal. And we've now had many, many people, over 2,000 physicians trained, over 10,000 people go on the protocol. And many people, and I just got another post on Facebook I saw yesterday where they were saying, my father has done so well now for 9 years. So it's always great to see stories of improvement. We've actually just posted a couple of preprints of first examples of people with Alzheimer-related conditions like posterior cortical atrophy, which is one of the presentations of Alzheimer's, and corticobasal syndrome, which is another very uncommon presentation of Alzheimer's, reversing their decline. Now, what happened after the first three books is we realized what we're doing for people who actually have cognitive decline is also helpful for all of us. So we wanted to get something out for everyone to say, how can you be sure that your brain span is as long as your lifespan? So whether you're going to live to 80, 90, 100, what have you, you don't want to have a brain span that's shorter than that. You don't want to spend the last 10 years of your life in a nursing home. So what can we do to make sure? Now, the great news is there are new blood tests, like what we call brain scan, a p-tau, 217, GFAP, and NFL. There are now new ways to look at this. There are now clear tests that we need to know your insulin sensitivity versus resistance. We need to know whether you have a leaky gut. We need to know what your gut microbiome looks like, and so forth and so on. And of course, we need to know what your oral health status is. It's a common, as I mentioned, very common contributor to cognitive decline and undertreated and underappreciated by the neurologists who are treating decline. So these things are all important for people, and there's a close relationship between what's going to go on ultimately to Alzheimer's and just the day-to-day fact that many of us are not getting the best cognitive health that we should and protecting our brain. As I mentioned in the new book, The Ageless Brain, it's a combination of performance and protection. That's what we need throughout our lives. We need to be able to perform. Now, you can get performance without protection with things like cocaine or Adderall, but that's not a long-term solution. That's a short-term solution. We want best performance and we want best protection. And so that's what the ageless brain is all about. And it's about finding things that you are headed for down the road and making sure that you never have to worry about this. The reality is that if people start early, if they get evaluated and they get on active prevention, and we recommend this for anyone who's over 35, to make sure that you're going to do well for years to come, virtually nobody needs to get Alzheimer's disease. I know that's surprising to hear, and it's a change in the way we think about it, but because we understand the underpinnings so much better than before, in fact, you can make it so that very few people have to get this.
Right. Yeah, it's very exciting what you've done, the success you've had. And I've heard about this woman who's walking across the country. And I think we can follow her. And there's a link that we can actually see what her progress is. So we'd like to include that. So that
Yes, judywalks.org.
Judy walks, that's right.
JUDYWALKS.org, judywalks.org. Check it out.
Thank you. We will, absolutely. So, in your research, you found that addressing oral pathogens, gum disease, and airway issues have had a profound effect on cognitive health. And you've even endorsed products like the StellaLife rinse and gel and oral probiotics as part of a brain healthy protocol. Can you share why these oral interventions can be so impactful and how
Yeah.
this creates a unique opportunity for dentists? And as a hygienist, I really appreciate this opportunity to help these patients that we see every day. So tell us more about that.
You know, one of the physicians I trained who's getting very good results told me that the most impactful things he sees immediately when is first seeing his patients with cognitive decline happen to be for treating sleep apnea and treating changes in the oral microbiome. So, I've used Stella Life Rinse myself many times. So, improving the oral microbiome turns out to be very helpful. And of course, the oral probiotics. These are turning out to be very, very helpful. It's clear now that many people who have cognitive decline or who are at risk for cognitive decline have changes in their gut microbiomes, their oral microbiomes, and even their rhinosinal microbiomes. So these are important players, and this is why things like having appropriate rinses and probiotics from Stella Life very helpful. We're always looking at the same thing. What is the best outcome we can get for each person? Can we prevent the problem for the life span of the person? Can we reverse the problem if they've already had some cognitive decline? And we encourage everyone to get in early, of course, because it's easier and more complete the earlier you start, even though we do see people even in late stages who show some improvement as well. But it's easier and more complete if you start early. So absolutely oral probiotics, rinses, optimizing your oral microbiome. And of course, I mentioned the mercury. That's another issue. Seeing the appropriate biological dentist to get rid of that toxin. And of all the heavy metals, mercury is the one that's most closely associated with Alzheimer's disease.
Yeah, yeah. So definitely in the dental community, we have this amazing opportunity because we're on the front lines. We see these patients all the time, and we know that this disease begins very early on in life. So we have all this technology that we can utilize as a longtime hygienist and educator, using salivary diagnostics. When we do that, we find patients that show no symptoms, and yet they have all these pathogens above threshold, often including FN or PG. So we
Yep.
can do so much more. And historically, Alzheimer's care has been in the hands of the neurologists and the primary care physicians. And you have a large network of these physicians, but this is so important. How can we help our doctors to the dentists themselves to get Recode certified and be part of that community so that we can help them get involved in this?
Yeah, this is so helpful. And again, will help achieve better outcomes. As I mentioned in our trials, we used we looked and worked with dentists and used their cone beam analysis, their treatment of all these various conditions, changes in the microbiome, P. gingivalis, all these things. It was so helpful. And by the way, a few patients recently we found who had some continued decline turned out to be cone beam positive, have some occult abscesses that hadn't been picked up before. When those were treated, people actually did better because anything that's creating that inflammation is increasing your risk for decline. So I would say to any dentists who are interested, please help us. Please work with us. Please get Recode 2.0 certified. There's Recode 2.0 training. We have some of the most outstanding physicians, neuroradiologists, et cetera, in the world who people like Dr. Anne Hathaway, Dr. Chris Shade, Dr. Cyrus Raji, who are all, Dr. Neil Nathan is another excellent one, that all are in that as part of the training, have fantastic modules so that people can understand and treat these better. And I think, it will enhance your practice. There is no one more grateful than someone and their family who has reversed their cognitive decline because they recognize this would otherwise be a terminal problem, a terminal medical condition. So you will help them, and you'll be part of the new movement in medicine to understand networks and systems biology and treat patients in that way. So thank you to everyone who's been helpful, and we look forward to working with anyone who is interested in learning this and working with us.
Thank you so much, Dr. Bredesen. I feel really empowered and we can do so much together. So we appreciate all that you've done, with your career and looking forward to supporting what you do. So everybody on this call, I do hope that you check this out and look at the possibility of offering this incredible care for your patients. So thank you for joining us today and look forward to seeing you when we have our next Innovators interview. Take care. And thanks again, Dr. Bredesen.
Thank you, Liz.